Hey guys, I hear from students every once in a while that they're really struggling with their clinical instructor and they're worried that they're going to fail. I mean, clinical is supposed to be such an exciting time, and you get on the floor and there's this kind of an intimidation factor that starts to happen because they're so knowledgeable, they hold the key to your pass or fail, and sometimes we're just so worried and anxious that we're not even sleeping anymore at night. And I don't want that for you. I want you to go to clinical feeling like you have the support of your instructor and that you can go back at the end of the day and feel really good about the work you've done and the team that you are part of. So I find this to be such an interesting topic because for all the years that I was in clinical, I often would think of myself as someone who was quite supportive and open and, very approachable. And without fail, at the end of every clinical, while we did get through it and there was a lot of good moments, I would always learn that my students were still intimidated by me. And I thought that was super fascinating because I am like a super fan supporter of the students, and I will advocate for them and teach them, and I will do as much as I can. And I would always be really disheartened to hear that my students would go home so stressed out and crying at night that it was really affecting their safety on the floor and their own health. So I want to share with you 3 tips to help you reduce that tension and feel like you have the support of your instructor, even though they hold that pass-fail in their hands. Now, one of the first strategies is to request time with your instructor. Now, this can happen at the beginning of the shift. If you've done your research, you've got your daily plan, and you're like, I have this dressing at 2 o'clock, but I'm not 100% sure if I have all the elements that I need to know to be successful. So you can set that stage at the beginning of the shift and ask your clinical instructor if they'll have time around maybe 1 o'clock, an hour beforehand, to just run through things with you. Or if they want to be with you, then maybe 20 minutes beforehand, run through it, get the dressing done so that we're efficient in time and resources. Now, the reason I say request time is because your clinical instructor has 6, 7, 8 students and 8 to 16 patients that they are overseeing. So they have a very long list of things in their mind that are priorities for them in terms of students that they would like to sit with, procedures they would like to observe, knowledge they would like to assess. So they've kind of got a schedule in their mind already, knowing that these things happen. So requesting time ahead will help set the stage for a successful conversation later. Now, I know what you're thinking. What happens when something happens in the moment? And I would suggest this. First off, if there is something that's life, limb, or eye, you're going to pull that cord bell out of the wall and get the support of a team behind you right away. That's what we're there for. Whether that's your buddy nurse or it's the clinical instructor to help you. If it's not life, limb, or eye, meaning it's not like I need you right now, you'll just share with your team, I've got to go find my instructor because I want to talk about this issue. And then you go find your instructor and see if they have time. If they don't have time to deal with it now, because again, they have a list of things, they might have to go hang a potassium in a room where somebody is not, their potassium is low, they may have to go and maybe the patient just coded or they're going for a procedure, they've got other priorities and your issue may not top those priorities. So when you find them and you say, you're going to give them a 1-statement kind of brief scenario. Hey, I have this situation with my 42-year-old post-op lady. It's about a medication, and if you have time now, I'd love to talk about it. If not, I'm going to have my primary nurse take care of it because I have some questions. Let your clinical nurse then decide the priority of that, and they will give you a decision. It means nothing against you if they say, yeah, have your primary nurse take care of it. We can talk about it later. They're just supporting your decision making. So that's the first step, is to request time. Now, once you have the time with your clinical instructor, we're going to go over 4 different things you want to include in your story and why you need support. Because we're going to kind of give them the situation now. So we've requested time, and now I need to tell them what the situation is. The first thing is, again, give them that 1-sentence overview and say, okay, so my 42-year-old post-op, I've noticed one of her medications that she gets weekly is actually out of range for what I can give, and I've looked at, so there's the story. The second thing is tell them what you've done already, what you know. The third thing will be tell them what your question is. And then the fourth thing for a bonus is to share what you think needs to happen, but that you'd like to just kind of talk it out. So here's how that would look. I have that 42-year-old post-op patient, and I was getting ready to review her medications because we're re-implementing them today, and I noticed that one of them is out of range for what is considered normal. Now I've consulted, going to step 2 or step 2B, I've consulted with the drug guide and I've looked at the medication orders, and I don't see a policy on the unit that would reference giving this drug out of range. Now, my question is, I see it's been given pre-op and there's been no change in her dosing, and I'm wondering, how do I find out if I can give this? My intuition is there's probably something I'm missing here, and I'm hoping you can help me figure this out. That last statement is actually step number 3. Step number 3 is bring them on as an ally, a co-researcher, a co-discoverer, and let them know that you're coming to them because of their insights, their knowledge, their experience, that kind of stuff, right? So simply saying, I'm wondering if you can help me troubleshoot this to see what I'm missing. Or I would appreciate your insights on this because I'm new to this and maybe there's a gap in my knowledge. Or you can even just say, I'd like to run my thoughts by you to see if there's something else I need to do. So those are your 3 steps. Request time. And within the requesting time, you want to give that one brief line so they can prioritize it. 2, give the situation that includes a 1-line statement, what you already know, what your question is about it, and what you think your intuition will tell you. And then step number 3 is to request their support as a co-researcher to help you raise up. Now, here's a bonus hot tip for you. Clinical instructors will always be looking at things through the lens of competencies. And when you come to them and request time, there's a competency about prioritization, communication, planning that they can use. When you come and you share the brief scenario and the situation about what's happening, those are competencies about communication. Those are competencies about knowledge base. Those are competencies about maybe pharmacology. Those are competencies about using your team resources. There's a lot of ways in which we're looking at these scenarios. There's also competencies about being self-aware on knowledge deficits, right? So these are all great things. So I want you to recognize that when you come with a question, we are looking at this through so many lenses, and we are super proud that you have recognized that there's a limitation, there's a block, there's a barrier, there's a gap, and you want to figure out how to get over that to make sure your patient is safe. That is another competency that we are assessing everything through. Patient safety is the bottom line. So you can even share that in your step 2 when you give your brief overview. I'll share with you an example of how that sounds, but if you can tie it to the competency that you want to make sure the patient is safe and that you're practicing according to your regulatory body, those are also competencies. So let's go back to that 42-year-old. Hey, Tammy, I'm wondering if you can help me here. I think I might be missing something. I'm buying her in at the beginning. Do you have time to talk about my 42-year-old patient post-op? For sure, let's talk about it. All right, so she's post-op day 2 and we're reintroducing her medications. I was researching them and I realized that there's one medication she gets weekly, but it's outside the normal dose range. Now I've looked at the drug guide, I've looked for a policy, there isn't one on the hospital unit, and I've checked the medication orders and it is transcribed accurately. So there's the story. My question is, I want to make sure my patient's safe and I'm practicing according to my regulatory body, and I know I can't give this because it's outside of the norm. So I'm not sure how it's been given in the past and how I can go safely about providing this, and I don't know where to find the answers. Can you help me? And they may start asking, oh, I forgot the intuition part. You can say, my intuition is there's something I'm missing and I want you to help me troubleshoot this. That's an example of leading in and connecting it to a competency of patient safety, which if you can drop them all to patient safety, that's gold. And saying that I need your support so that I can make sure I'm safe. Now, be prepared for questions. Remember, questions are good. they're going to ask you questions to evaluate, to assess, to draw out, and to help you trust your knowledge, to help you trust your intuition, to help you feel like you're supporting yourself by asking these questions. You should welcome questions. I'm going to tell you, if your instructor is not asking you questions, you should be asking them to ask you questions, because it's the only way they can see your thought process. So if you would come to me with this question, I might say, okay, what does the drug guide say is the normal range? Oh, you know what? I wrote it down. Let me open it up so we can look at this together. Use your resources. Pull open the drug guide. If it's on your phone, open up the app. Okay, I see that it says 20 to 40 milligrams and you have a 60 milligram dose. That's great. I'm glad you caught that. And the order said 60 milligrams every week. Yep, pull out the doctor's orders. You're going to have them there because they're going to want to see your process, right? And then I might ask you, well, who else on your team might be a resource for you? Because I'm not always going to be here. And I want to know if you can stretch beyond the drug guide, the policy, and you looked at the doctor's notes. Who else might you call or talk to? And you might go, well, I could talk to my chart or my buddy nurse. Yep, that's great. And they're always a great resource, but we want to get to something a little bit more concrete where you feel, because a nurse could just say, oh yeah, we just do it all the time. So you want to get to a resource that's going to help you feel confident in your decision to either withhold that medication or to give it. So who else on this team might you want to talk with? Oh, I guess I could call the doctor. They're not on the floor right now. And they usually don't respond quickly. So, I mean, I definitely could have the primary nurse give the medication today if she's comfortable. And then when the doctor comes up, I can ask them so I understand better where this is coming from. Excellent idea. Is there anybody else on your team that you might want to talk with? And then this is where the students will start to sweat. Excuse me. This is where the students will start to sweat. Like, oh my God, there's somebody else. Your pharmacist. I might offer that to you. What if you called the pharmacy? Would they have this information that might help you make a decision? Oh yeah, I could totally call them and they're always available. And so these questions that your instructors are asking you are not meant to be punitive. They're not meant to point out the things that you didn't think about. They're meant to point out the things you didn't consider as a resource to help you build your competencies, to help you build the strength in your team and stretch you to identify what you could do as well. And then I would share with you, okay, listen, you're going to call the pharmacist and let me know what they say. And I'll go off and do something else and we'll come back. And these are the ways in which your clinical instructor is supporting you, not taking you down. Okay, so just remember that. All right, so let's recap that. And then I'm going to share with you something else here in a few moments that you might want to get. Now, in terms of those 3 steps, the first one is to request time. Remember that your burning issue in this moment may not be the burning issue for your clinical instructor, and you may have to hand this task back to your team, and then you can talk about it later and maybe pick that up the next day. All right, so request time. And that's your brief umbrella. Here's the big scenario. I have a 42-year-old post-op and I want to talk about her meds. Once you have time, give another brief statement, bringing them into the actual moment. I was researching her meds and I see this weekly one is out of range and we're re-implementing and I don't want to give it unless it's safe for the patient. I already looked at the drug guide and I've researched hospital policy and I've looked at the medication notes. My intuition says that it must be safe if they've been doing it, but I don't have the evidence to support it. And I would like to talk with you about this to make sure I'm not missing anything. All right, so step 3 is ask them for their support. Ask them to help you troubleshoot, ask them to help you pick apart gaps, ask them to help you if there's something else you should consider. That's what your clinical instructor is there for. She's there to help you identify those pieces, and she can't do that if you don't come to them. I keep saying she cannot do that if you don't come to them with these moments to utilize them as a team member and as a support to help you grow, because every clinical instructor Now, sometimes there are offensive behaviors that you need to address. Yes, even as a student, you get to step into these moments. And if you're finding that as you're talking with your clinical instructor, you feel like they've rolled their eyes or they've sighed or they've made a comment that has made you feel uncomfortable, that is a moment for you to step into and to share, hey, you know, when you sigh like that, it makes me feel like I'm kind of stupid. And I'm wondering if maybe you think I'm not going to make it here. Can you help me understand? And I know your heart's going like this right now, but I will share with you, this is exactly what I do with my students as well. We work through these conversations. We've had many fantastic results with these difficult conversations with a buddy nurse, with a patient, with another team member. So if you are struggling, I want to offer you a free download. There is 10 safe conversation starters. These are scripts. You can use them word for word to help address offensive behaviors, which I know you're going to come across them in the clinical practice. So download this document. And the second thing I want to share with you is I have another YouTube station that talks all about difficult conversations, conflict, bullying. I would invite you to come on over to that channel as well and subscribe so that you get these resources, these talk tips, these tools and strategies so that you can come into these difficult moments with more confidence and create a career where you feel respected, appreciated, and empowered to be the difference that you need to be successful in clinical. All right, my friends, that is it for today. I hope to see you on the other channel. Obviously, drop your comments below. Let me know how this has helped you. I expect to be a flood of comments about instructors who were hard, difficult, impossible, people who got failed. Love to work through that with you. So drop them below and make it a great day.